This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
today our goal really is to try and understand a little bit more about headaches.
Extend your arms forward, and now please close your eyes. Raise your head a bit. Excellent.
Mostly on the top.
We've all suffered at some point in our lifetime from headaches. Some of us get mild ones, while others get more severe forms of headaches. I'm Dr. Khawla, and in this episode we will learn more about headaches. Good morning, Dr. Mahmoud.
Good morning.
How
Hi,
are
Dr.
you?
Khawla. Alhamdulillah. How are you?
Good, thank you for having us today.
Much welcome anytime.
Today our goal really is to try and understand a little bit more about headaches. And maybe I'll start out with a question for you, Dr. Mahmoud. What are the most common cases of headaches that you see in a neurology clinic?
Generally, headache is one of the most common complaints worldwide. There is nobody in the world who had never ever developed headache for even at least one time in a year. Short time, long time, persistence, or episodic. So it's also in the clinical practice, it's one of the most common complaints of the patients who are following with us. Generally, headache is divided to two main categories: the primary headache and secondary headache. Primary headache, which is due to a functional disorder, and its types here we can say about migraine, cluster headache, and tension type headache. On the other hand, the second category is secondary headache. Here we have a structural disorder or an inflammation which can cause as well the headache: brain tumors, sinusitis, elevated eye pressure, or what's called glaucoma, or cervical spasm sometimes can induce this one, or temporal arthritis. Those are belonging to secondary headache.
So how can you tell the difference between the two?
The cornerstone in diagnosis is depending on the history itself. I should talk with the patient, asking him very details when this headache started. Is it episodic? Is it continuous? How is it triggered? How is it became more stable? What are medications he is using? Is it associated with vomiting, nausea, or blurred vision?
Good to know.
Yeah.
Good to know. Well, this is a great time to maybe bring up a patient I know. She's quite young, Fatma. She's coming in today, I believe, because she's been suffering from these severe, constant headaches really for quite some time. And I believe they've been getting worse lately. So really our aim today is try to get to the bottom of it and the cause of her headache.
Okay, much welcome. Let's see.
Thank you.
Hello, hi.
Hello,
How are you?
hi Fatma.
How are you?
Have a seat. How are you?
I'm good. I'm
Oh,
good.
good.
Thank you.
What's the problem with you?
I've been suffering from headaches constantly, but I don't know what's it actually. So I want to find out so I can have, peace of mind.
Yeah. How long you have been suffering of this headache?
It's been about a year.
About a year.
Yes.
Is it episodic, like attacks?
Yes.
We would like to know the frequency of those attacks. Once monthly, twice monthly,
Every
or
2 weeks in a month.
Uh-huh.
Okay. So every 2 weeks I do get constant attacks.
So how long one attack lasts?
I think it lasts for about, 1 hour.
Is it sometimes exceed an hour? For instance, 3 hours, 4 hours?
Yes, I can say that few hours, yeah.
Few hours?
Yes.
Uh-huh. Where is exactly, which location of your head?
I think it's mostly on the top.
On the top?
Yeah.
During the attack itself, what are you doing? I mean, are you stay stable, or do you like to close your eyes to keep it quiet, or you can continue your routine activities?
Actually, I like staying away from light.
Uh-huh.
The light bothers me a lot.
Uh-huh.
You know, the darker, the places, I feel more comfortable.
More comfortable
Yeah.
Of it. Now, what about sounds? Are they bothering you during the attack itself?
I noticed one thing, that usually when we have family gatherings, when my nephews and all they're around, I get really annoyed with loud noises. I like quiet places.
Now we finish our interview, and let's go for a neurological examination and assessment. This neurological examination is different than the other body examinations in the other branches of medicine. It's very easy. It consists of some movement of your eyes, facial muscles and expressions, hands, arm, legs, and finally we will examine your balance. That's what we are going. So have a seat, please, here. Would you please stand up now? Let's check your balance and walk.
Okay.
Excellent. Can you please join your feet together like V? Like V letter, please. Excellent. Extend your arms forward. And now please close your eyes. Raise your head a little bit. Excellent. Now keep like this. Now several seconds. Let me check your balance. Very good. Open your eyes. A few steps back. Okay. Now let me check your neck flexion. Relax, please. Very good. Have a seat, please, back to your table. Excellent. Now we finished the neurological assessment, and we found, alhamdulillah, everything is normal, including the motor system, the sensory system, the balance and coordination system. Everything is normal. But usually in headache, we can find that neurological assessment is normal, unless if we find any abnormality at that time, it's a kind of red flag. So CT scan or even MRI at that time is mandatory. Now we can switch to the third step in our diagnosis process. We should run a CT scan for you, Fatima, just to rule out. Probably there is nothing in your brain, but we should rule out any abnormality. Okay? So let's go. I'm going to order it.
Eyesight is one of our most important senses. Our eyes are important for our perception of the world. But could our eyesight really be a problem that's triggering our headaches? I'm here today to meet with an ophthalmologist to find out more. We're exploring today the topic of headaches, and I know that sometimes the eyes might play a role in headaches. Can you tell us more?
See, yes. As headaches, there are definitely some headaches which are associated with eye causes, but it is also important to appreciate that there may be headaches which may not be related to the eye. So first, what I would do is explain which are the headaches which are more serious. They may not be related to the eye, so they are basically the primary headaches, the headaches that we have because of either migraine or because of tension headaches. Now, these type of headaches may not have anything to do with the eye, but yes, there are other causes which are related to the eye, and they may be the causes for the headaches in the patient. Especially like, for example, let's say if the patient is having a headache in the morning, the headache is you have the headache in the morning when you're getting up from sleep. headaches which are so strong that wake a person up from sleep. These are usually not the type of headaches that occur because of eye lesions. The headaches which occur because of eyes are more related to strain or because of focusing issues. Classic example is let's say dryness of eyes. With a lot of electronics nowadays, a lot of people having constant use of electronic devices, computers, laptops. What happens is long hours of work, so they are basically staring into the screen. Because they are staring into the screen, let's say this is the front of the eye, and there's an invisible layer of tear film in front. So what happens, because of staring, it is not getting replaced, and what happens is over a period of time the quality of vision degrades. And since we have two eyes, the brain detects this difference and tries to correct this so that the patient is able to see. The irony of things is the patient can see well, but what is happening in the background is the constant fight which is going on between the brain, which is detecting the differences between the quality of vision between the two eyes, and is constantly correcting it. So especially, after say maybe an hour or a half of using these electronic devices, the muscles of the eye or the fatigue out. It's something which is very similar to an autofocus camera. So if the lens is not able to focus, the film doesn't allow, and the battery drains
So
out.
the eye is sort of the gate to the inside of the brain.
Yes, that's the only part of the body where we can just take a peek inside and get a brief idea of how the nerves is doing, or is the eye not related in the cause for the headaches.
So what do you say to those who have a desktop and they need to stare at a screen for 8 hours a day? How can they prevent headaches from
It's
that
actually
strain?
very easy because first thing that I would say is if a person has glasses, it is recommended that they use the glasses at the time when they are using computer. Anything within their arm span, it's very easy. If they're using things within their arm span, especially if they have astigmatism, low grades of astigmatism, they should be wearing their glasses, because as the distance increases, maybe the effect is not so much, but especially when they're working at close distances, whether on computers, they love sewing, they are reading a novel for hours together, they should be wearing their corrective glasses. Another thing is they should remember and consciously blink so that the eye doesn't become dry. So these are conditions which they require.
Keep it naturally
lubricated. Yes. So what I usually tell all my patients, consciously remember and blink every 15-20 minutes.
Very good, very good. Thank you. That's appreciated. Thank you very much. So Fatma, I heard from our conversation that you've been dealing with a lot of stress lately. Yeah. Okay, so one idea might be to go and see a physical therapist or a massage therapist, in other words, to see if they can help with that stress a little bit. Are you interested in going and seeing one?
Yeah, I am.
Okay, that's great. Let's go then. Hello.
Hi.
How are you again? Good to see you.
Thank you very much.
I brought you today a new patient, Fatima,
Yeah.
who has been suffering really from a lot of stress-related headaches, and I'm hoping there's something we can do to help her out.
Okay. So we can briefly just say about the headache tension kind. Mainly the headache tension kinds comes from the base of the skull, going over the head until the front of the eye. So it's mainly one-sided of the head. Numbness sometimes, tingling, headache, tension. So physical therapy for this case, we can demonstrate some exercise and stretching for the patients, self-treatment. And it is very effective, and it's bring good result. First, we use what we call it the ice pack. It's like this. It's for the neck. We can wrap it with tissue or towel.
Is this something that people can buy from outside?
It is available on the medical stores, on the pharmacy. It's available, ice pack and cold pack available. And by the way, this can be hot pack and cold pack. If you put it in microwave, it will be hot back. In ref, it will be
So
cold.
2-in-1.
Yeah, so we can put this one on the neck for like this way for 15 minutes. After that, the important things for headache tension type is the posture. Bad posture, it is causes tension headache. For example, I can say about bad posture, secretary used to work in computer like this, or driving like this, or people browsing mobile like this. So this is bad posture. So we can say that the right posture is to make it when you browse mobile like this, screen like this, typing in computer like this, and the driving should be in correct position like this. So patients like Miss, when she referred here, we can start, you please sit here, yes. The first exercise to correct the posture, we teach the patients what we call it chin tuck. Chin tuck, excuse little, yes. Chin tuck, so we keep the chin on in this level, not up, not down, and we teach the patients to push her neck like this way. So like this, so push back, yeah, 1, 2, 3, 4, and 5. She can do it this one 5 repetition many times a day. The things for this exercise, it keeps the head vertical to the spine. So the weight of the head will be less than if she go forward. After this, we give some ergonomic advice to the patients, how to sit, how to browse mobile, and how to drive. So all of these will benefit the patients.
Thank you again for having us
You're
today.
welcome.
Thanks,
You're
that
welcome,
was very
Doctor.
helpful.
You're welcome very much.
Can you walk us through her CT?
Yeah, now we run a CT scan for Fatima just to check her brain and skull structure. You know that CT scan is a machine for which we can change the 3D organ image to 2CD. It's going to show us slices in the brain. So it's similar that we are going to check the brain from the top but into several slices. So we will start from the lower slice here, which show us here, this is the magnetum foramen, and going up to check her sinuses, they are normal. This is the nose cavities. And
So this is like Fatma laying down with us taking a cut through her head this
exactly,
way.
but in these images now we can see an horizontal cuts.
Yeah.
As slices, similar if we have a cake and we cut it to several slices.
Right, like
so
that.
we are checking every slice from its surface. That's it. So here we can go up more and more, and we can see this is the cerebellum, the organ which is responsible about our balance. And in the top of it there is the brain stem. We can go more up. We can see again here is the cerebellum and the brain stem itself. This is the fourth ventricles, and again the brainstem, cerebellum, and here we can see the temporal lobes of our brain. Here we can see the eyes balls, both sides, and the nose bone.
So the white structures are the bones.
The bones.
The gray structure is the brain.
The brain and others, as here in the front we can see as well the eyes. Outside of the bone here there are the muscles themselves, the here temporal muscle. Inside the bone, which the bone is similar to a box because the brain is a precious organ. So created by God to be protected in this hard box, which is the skull itself.
Thank you, Dr.
Much
Mahmoud.
welcome, much welcome.
Now going back to Fatma,
Yeah.
and what are the best practices? What are the things she should do?
Yeah, according to her history examination and CT scan, probably you are diagnosed as migraine attacks. So first of all, we should make a protection from those attacks. You should aware about the triggers. What are the triggering this headache, and you should avoid those triggers. For instance, you told me that there is a kind of stress, there is a kind of lack of sleep. All of those things you should avoid. You should organize your sleep. One more thing, that sometimes missing meals is a kind of a trigger. If you are missing meals, it also can induce this kind of headache. The second thing we can do, we can give you some medications can be taken during the attack itself. Those medications we are calling rescue medications. There are two types. First one belonging to one group of medication. Its name is the triptans, working on specific receptors in our brain. And the second medication is a kind of painkiller you can use when needed. That's all. We should change our lifestyle in a good way as well. Avoid stress, organize the sleep, avoid long-standing exposure to electronical screens, and not forgetting as well making sports and exercises. It's already approved that making 30 to 40 minutes of daily exercise can help us to control our migraine, because there are some internal morphines in our body. They are more exerted in our body to stop any pain. It's an internal painkiller created by Allah. That's all.
Thank you, doctor.
Much welcome.
Thank you.
God bless you.
It's been quite an eventful day for you, Fatima.
Yeah, it has.
How do you feel at the end of it?
I do feel better. Like, I never consulted a doctor before about my headaches, but now that I did, I know the problem. I don't need to worry, or even Google it.
Yeah.
So I feel very happy that I came.
Good.
Thank you so much.
Oh, of course. It's a pleasure to have you with us today.
Thank you.
Any patient who is suffering from migraine, if he has recurrent attacks of this migraine, I advise him to follow up with the proper doctor or neurologist to control this migraine, because those recurrent attacks of headaches, if he or she is not treating them, they will become more severe and more close together, and finally it will switch from recurrent attacks, it will become persistent headache, or what we are calling chronic migraine. And if the patient develops this chronic migraines, it's more difficult to be treated and managed by doctors as well. Not forgetting as well that I advise any patient who develop migraine to avoid the triggers, because those triggers are inducing this headache, and a coin of prophylaxis is better than a wealth of treatment.
Did you know that about half of the world's population suffered from at least one episode of headache in this past year? And headaches shouldn't be really taken lightly. They can sometimes be very disabling. They can result in loss of productivity and sometimes even work hours. So when should I go and see a doctor for my headache? There's so many reasons for that. One of them is if your headache is severe enough that you might describe it as the worst headache of your life. Also, if your headaches are accompanied by stiffness of the neck, fever, weakness, or numbness. I'm Dr. Khawla, and I'll see you next week with a brand new episode of Health Hub. Stay safe.